another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Elizabeth Morel, and Elizabeth will be speaking on low-pressure fitness for pelvic floor health. Elizabeth Morel is the owner of Little Movers PT. She graduated from the University of Scranton in 2008, where she gained her master's of physical therapy. Elizabeth has concentrated on pre- and postnatal moms and babies since her clinical internships. Post-graduation, she concentrated on treating children from 0 to 12 with a wide variety of complex diagnoses. She is versed in many techniques, including NDT as well as CranioSacral Therapy. Her current pediatric clientele is focused on feeding difficulties and post-frenectomy rehabilitation. In addition, Elizabeth continues to focus on moms both seasoned and brand new, rehabilitating the core and pelvic floor and re-educating posture. The technique she uses is called low-pressure fitness, which is a recommended therapy for postnatal moms in Europe and Latin America, but is new to the USA. Elizabeth also teaches the technique to other therapists and trainers around the country in order to share her wealth of knowledge about the importance of the pelvic floor. In her spare time, Elizabeth enjoys spending time with her family and exploring new countries. For more information, please visit her website at littlemoverspt.com. Welcome, Beth, to the call. I'm so excited to have you on today.
Thank you. I'm excited to be here and finally talk with you.
Yes, I know. We've been, for months now, Beth and I have been going back and forth about getting this podcast interview scheduled, and everything's coming together. She's now located, has a satellite office in my practice in Hoboken, which is very exciting, with Little Movers Physical Therapy. And today we're going to focus on the topic of low-pressure fitness for pelvic floor health. So I love for you, Beth, to start off by just sharing with our audience a little bit about who you are and how you got into the specialty of physical therapy for moms and babies.
Sure. So it's kind of a long-winded story, but I'll make it really short. I actually got into working with pregnant and postnatal moms and babies all at one internship out in California, where I had an acute care internship where my clinical director focused on the pre- and postnatal units, so working with the pregnant women who were having pelvic floor dysfunction or might have been on bed rest, working with those ladies, and then anyone who had anything postpartum come up. And then 50% of my internship was in the NICU. So I got to see these tiny, tiny babies and really help them out. And this is what really drew me into the mom and baby life. Then once I graduated, I focused more on the pediatric side, really starting at preschool age 3 to 5, then going all the way down to newborns, and then going all the way back up to teenagers, because that's definitely a harder specialty to break into. So once I got my newborns down, then I went back and started working with the pre- and postnatal moms again. Once I had my own baby, then I can start to develop my own business, which now includes both mom and babies.
Mm-hmm. Very cool. And so I would love for you to just, today's topic is focusing around the low-pressure fitness, and this is a new concept, I think, for a lot of our listeners. But, a lot of the women listening are either pregnant or have recently given birth and, may have never even heard of this. And, everyone, I think, is aware of that population of how important the pelvic floor is, but may not know about all the different options of rehabilitating it. So please share with us, what is low-pressure fitness?
Sure. So low-pressure fitness is definitely a new way of looking at pelvic floor and postural dysfunctions from a different way, focusing on pressure. So whether you are a pregnant mom or a postnatal or even a healthcare provider such as a yoga teacher, a Pilates teacher, a physical therapist, an occupational therapist, this is coming at the whole technique from a different perspective, using the pressure perspective. So the low-pressure fitness in general, it's a series of breathing and postural exercises which incorporate every muscle in the body but really focus on toning the deepest core stabilizing muscles and decreasing the intra-abdominal pressure. So that balloon that's inside that belly, we want to decrease the pressure in that balloon, and that's going to lift the pelvic floor up, pull the waist in, and that is what's going to help cure incontinence, stress-induced incontinence, or exercise-induced incontinence. It can help reverse pelvic organ prolapse. Any sort of tone issues, so some women, their pelvic floor is too tight, so we call that hypertonic. It's more like a trampoline. And some is too loose. Things are a little bit more lax, like cooked spaghetti. And that's a more low-tone pelvic floor, and that works to also bring that tone back up to more a normalized, nice, cushy but bouncy, movable pelvic floor, which includes your bladder, uterus, rectum, and then pulling that in with all of your abdominal organs. So in a nutshell, it's kind of an exercise routine, which then really normalizes the core and lifts the pelvic floor.
Which is just so important for a lot of us. I think even, people that haven't given birth, for example, men can have issues in this area because of all the sitting we do in general for work. Working at a computer, I think, really creates a lot of dysfunction in the core, posture, and pelvic floor. But, I know this is really relevant for women going through pregnancy and birth, especially multiple pregnancies and multiple births. So I love that there's this option. And, for doing pelvic floor physical therapy, and I've had other pelvic floor physical therapists on this podcast, Well-Adjusted Mama, and I think in traditional sense, there's that more of a internal type work that's utilized, and it's more hands-on, I guess I would say. And this type of work is different than that, right? Can you maybe explain the difference between this work and traditional pelvic floor physical therapy?
Sure. So traditionally, we like to use internal exams in order to make sure that women are firing the correct muscles, or using seeing similar trigger point techniques that we do externally, say on your shoulders, we do them internally to relax some hypertonic or really super tight pelvic floor muscles. And what we found is that actually just going through the exercise techniques themselves is giving the same releases to these women without needing that internal approach. So it's definitely a hands-on therapy where you're being touched and cued throughout each breath, throughout each posture. However, that's not an internal touch. And we've done it both. We've done it through ultrasound to watch the pelvic floor organs lifting, the abs tightening. You can do it simultaneously with an internal exam to make sure that all the muscles are firing correctly. And what we have found through research is that all the muscles are really firing, and so there is no need to do the internal at the same time. And most of the postures they're in all different levels of the body. So you could be standing, you could be kneeling, you could be on hands and knees, or you could be on your back. And that way, we're not having to follow a woman around with an internal exam or with an ultrasound probe, or even a biofeedback machine. We've used all those techniques to just verify that all the muscles are firing, and just with the technique alone, you can actually be confident that the correct muscles are firing. So that's pretty cool, because now it doesn't have to be used by a physical therapist trained with internal. It can be used by a personal trainer at the gym, which is what they use in Europe. It can be used by your yoga teacher who's going to incorporate this new kind of breathing in her yoga class, or your Pilates teacher who's going to work on opening the ribs now instead of closing the ribs. So it's really great because we can train all different kinds of clinicians to use the same technique.
So that's cool. So it allows more practitioners to be certified in this technique, right?
Exactly.
You're saying you don't have to be a licensed healthcare professional in order to be certified.
So you only need a license to touch.
Oh, I see.
Mm-hmm.
Okay. So even a massage therapist, for example.
Exactly. Mm-hmm.
Okay.
Mm-hmm.
And then it's less invasive, honestly, for women not having to have an internal internal work done every time they go for pelvic floor PT, I think that's an advantage as well.
Yes, and trigger point therapy and a lot of internal work is actually quite uncomfortable. And so we are also eliminating that factor from this technique. So it's very comfortable. It's hard work. I mean, it's a full body workout, but you're not going to leave sore or have cramps the next day, that kind of issue.
Right, which can be a common issue for women that are very tight and having the hypertonic muscles and spasm and the trigger points like you mentioned.
Exactly.
So I know you said this technique was developed in Europe, right? Can you tell us a little bit more about the beginning and now how it's slowly making its way over to the U.S.?
Sure. So the International Alliance of Hypopressivos started in the 80s when they started researching what pressure does to the body. And in Spain, this is where this originated, they found, oh, okay, this technique that we're using is kind of crazy. So there are a couple books that were written, Stop the Abdominal Massacre, and they really started researching, hey, what if we decrease the pressure inside the abdomen? What will happen? And so then they started finding that, hey, if you decrease the pressure inside the abdomen and you tighten the transverse abdominis, which is the innermost core muscle, you can lift the pelvic floor at the same time. So just as we breathe and we want to work on our diaphragm and use that appropriately, it's going to lift the pelvic floor diaphragm. Now, the International Alliance split in 2014, and Tamara Real and Piti Pinzach of Spain, they created their own company called Low Pressure Fitness, and that's when Low Pressure Fitness became a brand. Now, what makes Low Pressure Fitness a brand itself is that they incorporated the postures that you're going to stand in. So these postures look kind of like yoga postures, and they developed each one specifically to fire the transverse abdominals, to fire your serratus anterior, which is muscles that are connected to your lats on the side of your arms, and those really pull the ribs open and stabilize those shoulder blades. So they developed these postures, and that's how Low Pressure Fitness became its own brand. Now, since that happened in 2014, and they started teaching this exact technique, it is now all over Spain as the choice for abdominal and pelvic floor rehabilitation. It is all over France, and in France and Italy, actually, they allow you 6 weeks of physical therapy postpartum. It's not mandated, but every woman is granted 6 weeks, and they say that the use of low pressure fitness, having the hypopressive concept, is the concept of choice. So almost all women in France and Italy are definitely using low pressure fitness as their postpartum rehab, no matter who you are, whether you have dysfunction or not. They're just under the assumption that all women who've had a baby, their pelvic floor has been pushed down or compromised in some way, and it needs to be pulled back up. And just like our abs are, at 9 months pregnant, we have this bowling ball inside of our belly. It stretches your abs no matter how strong they were. And so we really want to tighten those back up. So all over Europe, it's being used. Across Canada, all the way from Montreal to Vancouver, they trained a couple hundred therapists just last year. It's down Central America, in South America. It's really popular in Brazil right now. Brazilians using it for more of an aesthetic purpose than a rehabilitation purpose, but that's okay. Doesn't matter why you're using the technique. And then we are in, I believe, over 18 countries right now. So it came to America just about a year and a half ago through our Canadian ambassador, and she came down and started teaching some classes here. And so we have now about 30 clinicians trained within the U.S., whether they were trained here by Trista or by Tamara, the owner, or up from Trista in Canada, because many women or tech clinicians who lived in the northern states, they just found it easier to go to Canada. So now we're trying to expand across the country to get, all clinicians versed and trained in this technique, as it can be such a global postural pelvic floor abdominal training system.
Mm-hmm. Wow, that's so exciting. So it's really like cutting edge, technology, technique. It's so non-invasive. It's very actually kind of simple, I feel like. I don't know if you would agree. It's fairly simple in its technology, right? Like it's just breathing and posture, and we don't have to make it complicated.
Yeah, I mean, the way, I guess in a nutshell, the way the technique is based makes complete sense. And it's an evolution, right? Just like we used to do full sit-ups, and then they started saying, well, that's horrible for your back and for your neck, so let's go to half sit-ups. Then they went to just the chin-ups. Then they went to full planks, and then they went to side planks, and this is the evolution there. And the concept is actually very simple. It's you have a balloon inside your belly, and every time you increase pressure in that balloon, and that happens when you are lifting a child or pushing something heavy, like carrying a box, or doing exercise, lifting weights, doing crunches, even coughing, sneezing, laughing, these are all increases in that balloon, increases in pressure in that balloon in your belly. Now, when you increase the pressure in the belly, that balloon is going to squish, and the places that it's not going to pop. So how does it squish? The belly pops out, and the pelvic floor gets pushed down. Mm-hmm. So the technique, the concept is quite simple in saying, hey, let's use the diaphragm in the appropriate way. So as you inhale, the diaphragm pulls down to allow air to come into the lungs. As you exhale, the diaphragm relaxes and stretches, and it gets all the way up the chest if your diaphragm is not glued to your ribs. And so as it stretches, it becomes a plunger. It grabs that balloon, that pressure of balloon. It pulls that balloon up, and when it pulls it up, it turns it into, it gets skinny in the bottom, and then it pulls that skinny in the waist, and then it pulls into an elongated tube. And your pelvic floor diaphragm is just a diaphragm, just like your thoracic diaphragm. And so as it plunges up, that thoracic diaphragm, it's going to pull your pelvic floor diaphragm up and flip up and look like an umbrella, just like your diaphragm does. And most of our pelvic floor diaphragms are down, pushing down, looking like a hammock, because we have that constant increase in pressure. And we never before had figured out, hey, if we use our diaphragm correctly, we pull it up like a plunger, and great, now we get to keep all of the organs, your uterus, your bladder, and your rectum, along with your small intestine, large intestine, and we get to pull them up and hold it in. And then when that balloon becomes skinny in the middle, that's where your transverse abdominals or your deep core muscles are really pulling in and tightening in. And when those tighten up, that holds those pelvic floor organs up. And while doing your postures along with this new breathing, where you're really doing thoracic breathing, allowing for that diaphragm to work appropriately, we're turning our abs into postural muscles, meaning that they're on all the time, rather than walking around pulling your belly button back. Actually, it's just on, because as you have good posture, then your abs are on. So our abs are now postural. Our pelvic floor is always up, because our diaphragm is being used correctly, and it's maintaining that plunger effect.
Mm-hmm. It's so cool. And I just want to appreciate how much I enjoy your enthusiasm and passion for this topic, because it's really important. And I think in a lot of ways it's an area that's been neglected for women's bodies, and there's been shame. Certainly the dysfunctions that come with pelvic floor issues, are kind of like, oh, let's not talk about it, let's ignore it, let's do surgery or take a medication. But there's really a lot that can be done proactively. We can do this stuff sooner after birth rather than years later, like let's say 20, 30 years later, like our mothers who are now maybe having some pelvic organ prolapses, and that could have been prevented if they had access to this type of work after birth.
Or incontinence too. I mean, you can be 90. You don't have to be in diapers. There's absolutely no reason, as long as your pelvic floor has normalized tone and you can lift your organs. Yeah, I mean, everyone can maintain their continence for sure. So it is. I mean, it's exciting because it's an easy concept. Anyone can learn the technique. Anyone can do the technique too. There really aren't many contraindications to doing it. And so it's, it's really good because we don't talk about it. And I think also just talking about, hey, you have a pelvic floor. What is my pelvic floor? I mean, I get that question all the time. My doctor told me I needed to work on my pelvic floor, but what does that even mean, right? And what about urinary incontinence? It's a huge thing with women during pregnancy, post-pregnancy, and how many times women sneeze and have a little leakage, and then it's just overlooked. They'll say it to their doctor, and they'll be like, don't worry about it, and in 3 months you'll feel better. But no, if your bladder is sitting low or tucked, tethered to your pubic bone, it's not just going to get better. You really do need to do something about it. And the answer is really simple. So just even bringing awareness that, hey, you don't need to sneeze and pee your pants. Hey, how about sexual intercourse postpartum? It's really dry or it's really painful. I feel like I have no blood flow. Yeah, totally. Let's fix that. Let's re-elongate that vaginal canal that got squished because you had a huge belly. Let's bring the blood flow back to the organ so that you can, maybe you were having dyspleasure or you want to achieve orgasm again. Yeah, let's bring blood flow back so that can happen. And these are all really fixable things, but in America, we just don't talk about them so often. So it's great to just, bring awareness and make women more comfortable about, hey, I can talk to my healthcare provider about this, or maybe I can even talk to my friends and, they might know someone who can help me.
Mm-hmm. Yeah, I think that's the exciting part is that there is help, there is solutions, and, women don't have to live with these symptoms, and that can sometimes be easily dismissed by their medical doctor because, unless it's severe, there's not many options in the medical community besides drugs and surgery. So instead of waiting for it to get to that severity, there's a lot that can be done more proactively and preventively. I wanted to ask a follow-up question. You mentioned in Europe, especially where it was just encouraged for 6 weeks postpartum for women to receive this low-pressure fitness type, treatment. Would that be applicable? Is that right after birth, whether it's vaginal or a C-section? What's the difference between the two births and how this technique works?
So you usually you just get clearance from your doctor, so whatever time that might be. So they are still going to go to their post. Once you
start exercising, that's when you would start this technique.
Exactly.
Okay, so for an average vaginal delivery, I think that is usually 6 weeks, and C-section might be 8 weeks or a little longer.
Might be 8 weeks, yeah. However, if you are trained pre-pregnancy, I mean, it actually is because of the increase in blood flow and you're putting your pelvic organs in the right places. It's great for fertility. So you might have been seeing someone previous to pregnancy. You might have helped them actually become pregnant, which would be great. Their bodies actually already know what to do. So all along the pregnancy, they can do their postures and their breathing. They just don't do the last piece, which is called an apnea. That's where you do a false inhalation, ending up with a stomach vacuum, similar to a bandha in yoga. So you don't do that piece while you're pregnant, but you can do the breathing and the techniques all throughout to maintain your continence, to keep your belly high and tight. And then postpartum, women, before they even go to the doctor, typically will just do the breathing postures because it's not strenuous on the body. Again, there's no pressure. It's a decrease in abdominal pressure. So you're not going to be putting pressure on stitches. You're not going to be pushing more blood flow out, anything like that. So women might actually do their breathing again. And then once they're released, then they really get into the training, doing the more intense postures, doing the dynamic postures where you're actually moving, rolling, asymmetrical, and doing those apneas again. So yes, it's typically about 6 weeks, but if you are trained in the technique, it can be, you can start your breathing. You're going to do your breathing throughout pregnancy, and you're going to start your breathing as soon as you deliver to start recovering, because it will help with your recovery.
So cool. So I know we've covered a few diagnoses or dysfunctions that can happen when you have a weak pelvic floor, but can you talk about some others maybe that we haven't covered yet?
Yeah, so I would say a big one, which is I think often overlooked, is just poor posture. And your posture, especially in pelvic alignment, if you have a really big anterior pelvic tilt, which is when your booty goes out and your lower back goes in, kind of like what you look like when you're pregnant, that's an anterior pelvic tilt. Your pelvic floor is overstretched at that time. And if you have a posterior pelvic tilt, so women or men who really clench their behinds and pull their tailbone under, that really shortens the pelvic floor. Also, people who work at desk jobs, we have the forward head, the forward shoulders, and that usually posterior pelvic tilt when you sit. What that does is pulls down on the pelvic floor. So performing low-pressure fitness will realign the spine from cranium all the way down to the tailbone, and that will realign that. No matter what, that's going to help improve your breathing. That's going to help improve your pelvic alignment, and then your pelvic floor kind of falls right into that. So really, we attack posture as a main source of pelvic floor dysfunction, which most people don't know about. In addition to poor posture, people who exercise a lot, like bikers, they really bring the shoulders forward and the head forward, and they collapse the lungs down. And when you collapse the lungs down, you really focus on belly breathing rather than breathing through your ribs and opening up that diaphragm. That can cause a lot of dysfunction within the abdomen, increase in pressure, collapsing of the, you don't get as much lung capacity that way. So those are typical clients that we work with. So who else? So anyone who has a pelvic organ prolapse, urinary incontinence, sexual, like I was just talking about, anyone who has pain with sexual intercourse, anyone who has a diastasis recti, which is during pregnancy when the abdominal muscles, the six-pack, the rectus abdominis, that will split apart. And it's very common and happens to almost everyone. It's just the severity of how much it happens. That can happen just around your belly button. It can happen a big diamond from your belly button down, or from your ribs all the way down to your belly button. What this technique will do, as the transverse abdominis, which is that inner corset muscle, fires, it's going to pull all of your abdominal organs back. And as your abdominal organs are now held back, so they're not pooching your belly outward, now your rectus, which is your six-pack, has the chance to rest, because we focus on breathing and turning off those muscles. Now, as those muscles are off and resting, the split that happens, the diastasis, that's fascia, which is basically connective tissue spider web that connects one side of the ab to the other side of the ab. Now it can heal. So you really don't, the diastasis is not a muscle. You don't squeeze it back together, but it can heal now that everything is pulled back and the six-pack is turned off without pushing that belly out and actually opening it back up. Mm-hmm. So that's a big one.
That is such a big one, and there's a lot of women out there that may not even know they have one, and they might be going back to their regular workouts of doing crunches and other Pilates exercises that can actually create more separation in their abdominal wall. So it is good to get that diagnosed, evaluated, diagnosed, and then have appropriate exercises to heal it so it's not aggravated and made worse.
Yeah, usually a mommy tummy, which is kind of a catch-all term, is often caused by stretching of the transverse abdominals, or they might not even be firing at all, so those deep inner tummy muscles. or diastasis. So there might be such a tear in that fascia that the two sets of abs are completely apart. So this mommy belly is, just weak and incompetent, essentially, fascia. So it's important to get it checked out, but you're right. I mean, women are often trying to put it back together like as if it was a muscle, doing crunches, doing planks. But every time you increase the pressure in the belly, that balloon is going to pouch out. And if you pouch out, all it's doing is separating those two abs. So we really need to keep everything back in order for it to heal itself.
That's right.
And then the last one that we didn't touch on yet is actually back pain. So, and you can definitely confirm this for me, but tons of men and women have back pain, and it's usually because of core instability. And that can be via pelvic floor dysfunction or weak abdominals. But once you train the transverse abdominis, that core, that muscle, to fire appropriately and be on all the time, it's like wearing a corset, or it's like wearing those weight belts that men wear to lift heavy weights, but it's your own. And if you have that internal support system, it takes the pressure off of the back, and also doing the postural techniques actually gives space and decompression throughout the vertebrae themselves, and that really helps with back pain. So men and women who have some disc herniations, or just some squishing there, or maybe some spondylolisthesis where the disc is slipping forward, or instability, just creating space in those bones that wasn't there anymore, and creating now a tight core set that you have, and also taking that pelvis and pulling it back into a straight alignment. All of those things together really decrease back pain. I mean, I have patients who were on bed rest for months and months, and now needing just doing their exercises are really helping them out, actually, which is really great. So even some patients that we share who were coming to you 3 times a week are now really holding their adjustments and not needing to see you as much, which is amazing. If you can hold your adjustment, it's exactly what you're looking for, those muscles to be firing to keep your bones in place.
I was just going to say that, when I see someone not holding their chiropractic adjustments, and, alignment is so important for nervous system function, we look at the weak core, we look at weak pelvic floor as a possible cause, and those are areas that need to be addressed, because, even I find people whose hips don't stay in the actual hip socket can be a pelvic floor issue. So it's really cool to see, when I am working with patients that are doing the exercises and getting chiropractic adjustments, they're really benefiting from the combination of both.
Yeah, it's maintaining a lot longer. It's really, really great.
It totally is. So let's talk about like what a typical session looks like of these exercises, and then maybe explain like if there's any type of home care that might go along with it.
Sure. So in a typical low pressure fitness session, whether that is a trainer, a massage therapist, a physical therapist, just low-pressure fitness alone, what's going to happen is you're going to do some breathing to warm up. You're going to make sure your clinician is going to make sure that you're breathing appropriately, that your diaphragm is working. They might work on some myofascial release to open up the ribs a little bit more, open up the diaphragm a little bit more. Then you will learn 1 or 2 new postures that you haven't learned before, or maybe that you haven't mastered yet. After that, you'll do a 20-minute sequence, which is the amount of time that you're going to be practicing your exercises on your own as well. So you'll do a full 20-minute sequence, and then you'll have a cool down. So that's what a typical session looks like. Now, if you come to me or maybe to another physical therapist, they'll probably do some extra things on you. So I do a lot of fascial work first. So I get the fascia warmed up with some exercise, I use specific tools to strip down fascia or open up the hip joints, make sure the ribs are open, and then I'll go into my low-pressure fitness techniques and cool down. But you can do it just as a traditional low-pressure fitness system. You'll do breathing, you'll do a new technique, then you do a full series and a cool down. And now typically you're going to be doing that one-on-one until you learn at least all the basic moves of a level one trained client even, right? So those are about 13 different positions that you can do on your own, and your clinician or your therapist will tell you, yes, like this is all the level ones, you know it, you're good at it, I trust you. And then from that one-on-one session, you might be able to move into a small group session. And that will be 3 or 4 clients. And it's more of a kind of an exercise class. Well, you'll still have one-on-one attention where your clinician will be coming around, giving you the manual cues you need, touching the elbows, touching the hands, telling you to grow, touching your head, so that they are really close to you and monitoring you to make sure that you have the right postures, you are doing the right breathing. They're close enough to touch you, but they're not one-on-one on top of you the whole time, because they know that you are capable of doing all the positions by yourself, and that will usually be a 20 to 30, well, I'd say it's about a 30-minute session with your warm-up, your cool-down, and your 20-minute full session in between. And when you're not in session, you are expected to be doing 3 times a week, 20 minutes per session by yourself to be able to maintain the practice. So just like you would go to the gym, right, you're going to make sure that you get your 3 sets of 20 minutes done by yourself.
Mm-hmm. Okay, that totally makes sense, just to maintain that the muscle memory and the activity. You're working on muscle, so it makes sense that there would be some repetition with it.
Yeah, and it's just like going to the gym. If you stop doing everything all together, can your posture go back to, that forward head, iPhone posture? Of course. If you had some problems with increased pressure in the belly where your bladder is now tethering to your pubic bone, can that happen again? Sure, right? We really, just like if you stop working out, but you get out of shape, yeah, we need to keep our muscles, whether that be your pelvic floor muscles or your abs or your biceps, it doesn't matter. We need to keep them in shape. So 3 times a week just for 20 minutes will definitely keep you in your tip-top shape right there. And the goal is to get enough clients trained where we can now use this as a regular class at the gym. So your fitness instructors, like they do in Spain, you can go, just sign up, go to your gym, sign up for low-pressure fitness class. Everybody's trained, so everybody knows what they're doing. And now, it's just like you would go to, aerobics. You're going to go to low-pressure fitness, and you're going to do your 45-minute session there. So that's the goal in America, to get everyone trained enough that we can really get into those classes, because the way that you're breathing is so important. We want everyone to have this plunger effect. That way there's no pressure in the belly. Everything's being sucked up. Everything is being held in.
That is so cool. So I know, Beth, one of your goals is to help get more practitioners, more wellness professionals trained in the U.S. So do you want to spend a little time describing what that, like, first of all, who would qualify as a wellness professional for the certification process, and then what that looks like?
Sure. So you need a license to touch, and state to state gives you a different license to touch. So I can't say based on each state, what is yes, what is no. But even from someone like a doula, right? They have a license to touch their clients, and they are perfect candidates because they're the ones teaching you, coming over your house a couple of times, teaching you this is the way you're going to breathe. So if they can teach you the right way to breathe from the beginning, they're going to be great candidates to learn. Then yoga teachers, Pilates teachers, they are perfect. And what the concept of low-pressure fitness is very different from both the concepts of Pilates and yoga. But what they can really learn is, hey, the concept of pressure, and how can I take this concept of decreasing pressure and continue to use my technique, use my yoga poses, use my Pilates, my hip flexor exercises. We want to do all of those, right? We want to focus on our glutes. So not in no way are we saying, hey, you're going to come to this class and you're going to change everything that you do. No, you're going to keep doing what you do, but you're just going to take our information and then incorporate it into your field of practice. Physical therapists are definitely the main sources of this treatment at this time, but also getting people trained such as midwives, doctors. What about urogynecologists? Those are huge because what they do is directly work with pelvic organ prolapse. And if they can send some of their clients, they can get trained, and then they can send some of their clients to other professionals who do this, as a living, they will be saving tons of women from having mesh or sling surgery, which is huge in itself. Other professionals such as, even someone such as a lactation consultant. So they're going to be firsthand postpartum often, right? If they come to the class and they learn the basic techniques, they can say, hey, in their checklist, are you having any incontinence? Are you having any pooching of the belly, things like that? They're the first line. So if they want to be trained, they can, help you out right there. They can do the technique with you, or they can also send you to the right professional as well. So these are the general kinds of clientele we're looking at, and especially, chiropractors, definitely. Chiropractors are so well-versed in so many techniques other than just typical manipulation. So chiropractors 100%, and they also, do a lot of, are also versed in craniosacral and Reiki and things like that. So they would definitely be in the line. And, of course, personal trainers and fitness instructors, because they're the ones who we really want to be expanding it throughout the gyms. That's huge. I mean, if we can get this in big gyms, like that's how they got it really blown up in Brazil. They got through those big gym brands, kind of like Gold's Gym is here. They got that done down there, and that's how they really kind of expanded their horizons down south. Also, CrossFit trainers. This is a huge population because when you lift extremely heavy weights, there is going to be an increase in pressure inside that abdomen. No matter how strong you are, no matter how good you are, the moment you lift a really heavy weight, there's an increase in pressure. And men and women alike are lifting such heavy weights that the pressure's so big in the belly, they have no choice but the urethra to open and to pee in your pants while you're lifting heavy weights. So CrossFit is a huge population that would be really interested in learning the technique and, make sure all the trainers are versed in it so that they can say, hey, make sure you're breathing through your ribs, make sure your diaphragm is relaxed, to make sure our six-pack muscles are not glued to our diaphragm. So that's a really big one. Now, the way the certification process works is there are 3 classes, level 1, level 2, level 3. After each level, you receive a certificate. And then after your 3rd level, you can choose to become a fully certified clinician. And so you'll be certified in low-pressure fitness. And there is actually a multiple-choice exam that you need to complete in order to become a certified professional. But after each certificate, even after level 1, you are granted permission to go and teach your clients all of the level 1 poses. And after level 2, you teach them asymmetrical poses. And, after 3, you're really teaching them dynamic poses. You definitely don't have to become certified. You don't have to take the test, but obviously it's the most credibility that you can achieve. So the goal is to have about 5 or 6 more classes, so low pressure fitness level 1 certifications before the end of the year. the next one, I think the closest one coming up is actually going to be taught by me September 10th, 11th that weekend in Princeton, New Jersey. Then we're going to be focusing on the Northeast and then the Denver area and San Francisco area first because they're the most populated areas that this technique is being used. So we really want to spread the wealth up here, and then we're going to go across the country as it becomes more and more popular. So if you just go to the lowpressurefitness.com website, you will actually see what level 1 classes are being held. And
is that a weekend to do the whole level 1? Like, are we talking 5 hours? Okay.
So we're talking 15 hours. Okay. It's Saturday and Sunday. They're always both days of the weekend, so it doesn't interfere with a work schedule. 15 hours. It's 50% in level 1. It's 50% practical, 50% theoretical. Mm-hmm. Level 2, it's a lot more practical than theoretical. I think it's about 80-20. And then level 3 is a lot more theoretical than practical. So level 1, you're doing about 50-50, and it's a Saturday, Sunday, always going to be a Saturday, Sunday class.
Cool. So if someone is a wellness professional interested in getting certified, they can just go to lowpressurefitness.com, find out what classes are coming up in their area, and sign up.
Exactly. And if it's not in your area and you think you have enough other coworkers that can make it work, then we can definitely work out something about coming to your area. So New York, New Jersey, Connecticut, we're definitely the most populated states of fitness, wellness professionals that have interest right now. So we're focused here, but if you have 6 or 7 coworkers who are all interested in taking the course, or 8, 9, it's definitely worth it for one of us. We have 3 coaches in America, myself, Michelle Weber, who is a wellness professional. She is certified in Pilates. She's a dancer choreographer. And we have Angela Mueller, who's in Colorado, Denver, Colorado. She's also a physical therapist, women's health physical therapist. So we have 3 coaches, and one of us will be flying to that area to teach a course. So if you guys can get enough people together to warrant a course, we will definitely 100% fly there and get that done.
Oh, that's so cool to know. And then what about for the mamas listening who would like to go into a certified professional in their area? How can they find out who practices in their area?
Yeah, great question. So on the Low Pressure Fitness website, will be the international website, and you can actually search with zip code or town or state. And that will give you the professionals that are within your area. Mm-hmm.
Okay, that's awesome to know. And it does sound like, you and these 2 other coaches are really actively working on getting more and more professionals certified to go out into the communities and really help the community, And this is something that is hugely important for women and especially new moms. But, to your point, this is also a technique that can be used with men as well. And, men also deserve to have strong core and healthy pelvic floor muscles.
Oh, definitely. And erectile dysfunction is something that we didn't talk about, but it's really helping men with erectile dysfunction because it is bringing blood flow to the penis. It is pulling the prostate back up into, just like that balloon inside the belly, it's also bringing that balloon prostate, pulling it up, bringing better pressure there. And, I guess they say that erectile dysfunction is about 50% of psychological as well as 50% medical, anatomy. And so once, men are getting better blood flow and they're feeling better about themselves, it's starting to change their psyche, which actually then brings that other 50% back. So it's really helping men with erectile dysfunction as well, which is pretty cool.
Oh, that's very cool. I didn't even know that was one of the benefits. So that's good for men and women. So that is great to know. So, Beth, thank you again for coming on the show and sharing your wisdom regarding strong core and healthy pelvic floor with the community. And, if women or men living in the Hoboken, Jersey City, New Jersey area want to come see you directly, what's the best way to get in touch with you?
So you can just find me on my personal website, which is littlemoverspt.com. That's the best way to reach me. And I am in Jersey City, Hoboken, Lower Manhattan all the time. So it's pretty easy to find me. Or you can find me at your office in Hoboken.
That's right. So once again, thanks for coming on. And, I really appreciate it.
Great. Thanks so much for having me.